Welcome back from the break. You're watching Newsx and I'm Asavdi Jindal. The headlines first. The National Investigation Agency conducted a massive search operation at 15 locations in 8 states across the country in a Pakistan-linked espionage case. NI has conducted searches across 15 locations across 8 states in the country with regards to a Pakistan-linked espionage case. Delhi Police's special cell arrested a 42-year-old man from Rajasthan's Deeg in a case related to an alleged spying network run in India by the Pakistan intelligence operatives. COVID-19 cases are on the rise across India with 3,395 active infections. The highest number of active cases has been recorded in Kerala with 1,356 cases, followed by Maharashtra and Delhi. Around 1,500 tourists were stranded across North Sikkim after landslides triggered by continuous rainfall. Meanwhile, searches for 8 missing people have been halted as Tista River swells. In response to the severe flooding affecting various parts of Manipur, the Indian Army and Assam Rifles has launched Operation Jal Rahat 2. 2 major rescue columns were activated as a part of the operation. Meanwhile, the total number of people rescued has reached approximately 800. Hours after Chief of Defence Staff General Anil Chauhan's remarks on Operation Sindoor, Congress President Mallikarjun Kharge attacked the government, accusing it of misleading the nation. And our top focus this hour, developments that are taking place as far as COVID is concerned, the uptick that has been reported day by day, minute by minute. India has reported a total of 3,395 active COVID-19 cases in the country. The Ministry of Health and Family Welfare has updated the number of cases, with Kerala reporting the highest surge with 1,336 active cases. A total of 685 cases have been reported in a single day. Kerala has been followed by Maharashtra with 485 active cases, and Delhi with a total of 375 patients with active cases of COVID-19. 4 deaths have been reported in the country in the past 24 hours, with 1 death each from Delhi, Uttar Pradesh, Karnataka and Kerala due to COVID-19. However, the government has maintained the most of these COVID-19 cases are mild infections and not fatal. It should be noted that there were 257 active COVID cases in the country on May 22nd. The figure rose to 1,010 by May 26th and reached 3,395. Citizens are advised to follow precautionary measures and safety protocol. My colleague Arzu is with us on the broadcast to give us more on this. Arzu, of course, day by day, the COVID, the number of active patients, those numbers are rising day by day. We just spoke about 22nd May, where the number was in hundreds, but now, of course, we're seeing a big jump in the numbers. What more can you tell us?
Well, definitely, COVID-19 cases are surging in India, with the total number of cases spiking to 3,207 and also 20 deaths reported. And if we say the state-wise also, there has been a lot of increase in the number of cases. And in fact, if we talk about the death data also, the Maharashtra is on the top with 6 deaths, and also Karnataka 3 deaths, and Kerala, Uttar Pradesh and Rajasthan reporting 2 deaths. In fact, Delhi has now reported 1 death, and there are a lot of states like Punjab, Madhya Pradesh, Tamil Nadu and Gujarat reporting 1 death due to the COVID-19. And in terms of the active cases also, Kerala topped the list with 1,147 cases, followed by Maharashtra with 681 cases. So the rising cases have prompted the Karnataka government to take the precautionary measures, advising the patient not to send their children to schools, or also if they have symptoms like cold, cough and fever, to prevent themselves from going to the the most populated places. And also the health department has confirmed that the new deaths in the several states, so if we see Delhi also, Delhi is also reporting a lot of cases of COVID-19 cases. There has been a surge since last week, and also the latest official data that is available showcase the number of COVID-19 cases in Delhi are around 375 active cases. Also one death reported of a 60-year-old
Yep.
woman. So the city has seen the surge in COVID-19 cases, and after May 23rd, the advisory has also been issued in the government and also the private hospitals to ensure the proper medication and also the proper bed facilities and oxygen facilities to every patients who are coming to the hospitals. Yes, Savri.
Absolutely, Arzu. Thank you so much for giving us an overview on that front. In fact, joining us on the broadcast is Dr. MC Mishra, former director, AIMS. Sir, very good morning to you, and thank you so much for taking our time and speaking to us on Newsx. Just talking about the numbers from 22nd May now, of course, we're seeing that the numbers have now risen from hundreds to thousands, and deaths are also being reported. We've been receiving a lot of phone calls here at Newsx asking what the situation is like and what one must do. So we want you to answer that question, sir.
Thank you so much for keeping this discussion this morning on a Sunday. What I would say that yes, there is number has increased, so must be the testing for COVID or non-COVID viral infections. And this is what we discussed last week also, that there are these new Omicron subvariants have been detected, and which includes LF.7, XFG, JN.1, NB.1.8.1, and basically they are easily transmissible, and there is no cause for panic as of now, according both to ICMR as well as WHO. Variants under monitoring, what WHO says, rather than various variants of concern. So we should be quite reassured that if we take universal preventive measures ourselves, those who are infected and those who are not infected, both. So should we be worried? Basically, while the new subvariants may be more transmissible than previous strains, but they have not demonstrated an increase in severity of the COVID illness. And their rapid spread has been noted in other countries also, like China, Taiwan, Hong Kong, Australia, Singapore,
Yes.
etc. And so what most experts believe and advocate, that maybe you can again think of vaccination for protection, but as of now, the booster may not help. And they also recommend wearing masks in crowded or poorly ventilated spaces, particularly like going into a lift with a lot of crowd, and also in buses and in local trains, the metro. I think that is what something we need to do in hospitals. We must take all the measures, precautions, particularly those with pre-existing health conditions, which lowers immunity. And given the trend showing this increased transmissibility but low hospitalization rates, the focus should remain on staying vigilant, all of us, and without succumbing to anxiety or panic. And the symptoms are no different than any other viral illness. Those are fever, body ache, headache, running nose. Maybe there some people may lose smell, some people may have loose motions. So what I call 3H: home care, hydrotherapy in case the fever goes 103, 104, and hydration. Keep yourself well hydrated, well nourished, rest at home, bring down the temperature by paracetamol, and the cold sponging in case it doesn't come down with paracetamol, which happens many a times. And most people have been recovering. Of course, the number of cases in your story has already been told, which states are having more surge than other states. But I think this increase is largely due to increased testing rather than because the viral spikes do go in winters as well as in summer months. And when these strains, new strains emerging in Omicron, which is easily transmissible and it's an airborne disease, so all those preventive measures which we have been discussing all last 5 years should be followed by most people if they want to save themselves from the agony of having the COVID fever. This is what I would say.
Right.
That no need for panic. Just be a little bit concerned so that you can prevent it. And you don't go in crowded places. You don't do make travel arrange plans if they are not really mandatory or necessary. So all these things put together, I think this spike, this surge will go up and then it will come down very rapidly.
Right, so absolutely. Now, there is another question that people keep on asking. They say that there are a slew of things that happen. You may have a runny nose, loose motions, as you were just talking about. The question is, when should one then go and get themselves tested? Because a lot of people don't want to go to hospitals as well.
Yeah, I would recommend don't run after the testing. It doesn't matter whether it's COVID or non-COVID, unless you feel breathless or your oxygen saturation goes down. And most of us now these days have those pulse oximeters which people bought during COVID pandemic. So it is not a pandemic situation. That's number one. Booster dose may not help immediately to combat this surge, and testing is up to the individual. If you want to test, you test. Otherwise, it's academic interest only, whether it's a COVID or non-COVID, it will add to the numbers. That is all what it is going to do. And most of the deaths which have been reported recently, 4 or more, they are not directly related to COVID illness primarily. Basically, these people have been suffering from other illnesses, serious illnesses, and also contracted viral fever, which might be COVID, which might be non-COVID. So this is something people have to understand. So not to worry about it, but be a little bit cautious so that you take the adequate preventive measures when you are going in crowded places, when you are traveling metro, bus or train, I think, or airports or any crowded places, marketplace or anywhere. And also we are taking precautions ourselves in the hospital by putting on masks when we are seeing a patient and their families, when they visit us in outpatients. And so not to worry, most people have been recovering without hospitalization. People should not panic that if they have tested positive for COVID, something will be very serious. It is not going to be like that. So just take it easy and rest at home, bring down your temperature, keep yourself hydrated and nourished, and also home care with paracetamol and whatever your family can support. Also isolate at home if possible. Not everyone has that luxury of getting isolated in places, but those who have that luxury, they can isolate themselves from other family members. So do not sit on the same dining table, do not sit and watch television, the same television. So I think if people take these measures, precautions, we can contain this number going up. Right. Testing, leave it to individuals whether they would like to have it done or they don't want to have it done, because the viral illness will settle in 5 to 7 days.
Right, sir, absolutely. Dr. M.C. Mishra, thank you so much for joining us on the broadcast, sharing, of course, guidance to our viewers on what it is that they should be doing as well. Thank you so much, sir. All right, we're going to leave it there and shift our focus to some more news coming in, where an international forum in Tajikistan made remarks on Pakistan violating Indus Water Treaty through cross-border terrorism. The remarks articulated by junior Environment and External Affairs Minister Kirti Vardhan Singh at the Glaciers Preservation Conference in Dushanbe came after Pakistan Prime Minister Shehbaz Sharif gave a statement on the UN-led global forum accusing India of weaponizing water, strongly condemning Pakistan's attempt to misuse the forum by raising IWT issues. Singh said that the treaty's preamble stated that it was concluded in the spirit of goodwill and friendship, and that honoring the treaty in good faith was essential, but the cross-border terrorism from Pakistan interfered with its implementation. My colleague Ajay is with us on the broadcast to give us more on this. Ajay, what more can you tell us at this point of time?
Clearly, the way basically Pakistan was trying to wreck up this issue on the international forum without any, requirement, and that was basically been replied by the Union Minister, and he says that we are appalled to at the attempt by Pakistan to misuse the forum and to bring in unwanted reference to issues which do not fall within the preview of forum, and we strongly condemn such an attempt. That is what basically Kirti Vardhan says, that Pakistan is basically wanted to rack up this Indus Water Treaty issue on the international fora, which was not their domain as well. So that's why this issue has been tackled accordingly, and that was he says what has happened after Pakistan they continuously supported terrorism, and after the Pahalgam incident, one union government took this decision that they will not follow the Indus Water Treaty agreement, because it is totally something which basically is done for a friendly environment. When Pakistan is not doing it, and Pakistan is spreading terrorism and pushing terrorists and in the Jammu and Kashmir, that is something which we also not to follow. So that's why they have decided to suspend this Indus Water Treaty, and they say that in the coming time we are open to do anything with this water, which basically we are only sharing as a friendly neighbor.
Absolutely. Ajay, requesting you to stay on with us. We have some more news coming in, but before we move to that, joining us at this point of time is Group Captain UK Devnath, defence expert. We're also being joined by Colonel J.S. Sodhi, international affairs expert. A very good morning to the two of you, and thank you so much for taking our time and speaking to us on Newsx. Of course, Indus Water Treaty is the big focus at this point of time. Group Captain UK Devnath, let me start this conversation with you. What do you make of these remarks that have been made, the stance that has been chosen?
Sabri, firstly, the forum used by Pakistan to vent out its unscientific cribbing was wrong. The place everyone assembled was for discussing global environmental changes and melting of glaciers.
Yes.
It was not a forum in which discussion was on sharing of international treaties, on sharing of any river water between two countries. Fact remains that this treaty was signed during 1960 when relations between India and Pakistan were near normal, or at least heading towards near normal. But subsequently, during 80s and 90s, Pakistan deviated from that near friendly relationship between both countries to a hostile attitude. Fact also remains that since then, a lot has changed on ground. The demographic pattern has changed, the seasons have changed, annual water flows have changed. India definitely needs more water compared to Pakistan, especially because we are the country which is controlling the water flow. Definitely, a lot of infrastructure has developed on Indian side of the border. We are not trying to bully Pakistan. All that we are trying to tell Pakistan that come and discuss before Pathankot happened or before Sindoor happened. In last 3 years, we had sent 3 invitations to Pakistan that as per Indo-Water Treaty Agreement, let us do a bilateral meeting between both the countries to renew the small finer prints of the agreement. But Pakistan has been refusing to hold the meeting for last 3 years. Even now, the World Bank has given a instruction to Pakistan that first resort to these problems by holding bilateral talks with India.
Right.
Pakistan must heed that advice from World Bank. Yes.
Absolutely. I'm going to request both our guests to stay on with us as we have some more news coming in, where Pakistani Prime Minister Shehbaz Sharif has said that nations no longer expect Islamabad to approach them with a begging bowl, but rather seek engagement as equal partners in trade, investment and innovation. Shehbaz Sharif said that he and Field Marshal Asim Munir no longer want to carry the burden of dependency on their shoulders. Sharif said the solution to Pakistan's economic challenges lies in fully utilizing the country's natural and human resources for profitable ventures. The Pakistani Prime Minister described China as a time-tested friend and noted that partner nations now expect Islamabad to engage with them through trade and economic cooperation. Listen in.
Iran, Azerbaijan and other Central Asian states are growing even stronger as we are ready to build mutually beneficial trade, investment and economic ties. China is the most time-tested friend of Pakistan. Saudi Arabia is one of the most reliable, trustworthy friend of Pakistan. And so are others, Turkey, Qatar, UAE. But let me make this point abundantly clear. They expect us now to engage them in trade, in commerce, innovation, research and development, education, health, investments, in profitable ventures, mutually beneficial. And they no more expect that we go there with a begging bowl. And I am the last person, along with Field Marshal Sayyid Asim Munir, to carry this burden anymore on my shoulder, because it ultimately translates on the shoulders of this great nation. So what is the answer? The answer is pure and simple, that the natural resources, human resources Allah Almighty has blessed us with, we must make full use of it and deploy them for these very profitable ventures. And if we are able to defeat terrorism, if we are able to put the nation together, which is united like never before, and if we are absolutely clear in our vision that we have to promote export-led growth, we must not promote those idling units in Pakistan.
All right, Colonel JSO, the international affairs expert, is with us on the broadcast. So, we've heard the statements, but do these statements suit a man and a country that in the past 35 years has taken 28 IMF loans?
Jai Hind Asavri. It's my honor to be on a esteemed channel and a privilege to be with the co-panelists. Well, you are absolutely right. These statements are all hollow, they are all false. Because nothing is going to ever change in Pakistan. Till the time Pakistan does not have a change of two of its main policies, one is being anti-India and the other is being anti-Hindu religion. Till the time these two policies do not change, there will be no change in Pakistan whatsoever. It was a begging nation, it will remain a beggar nation. Because the entire energy, the entire mindset, the entire mentality of Pakistan, which includes every Pakistani citizen, is only being poisoned for two things: anti-India and anti-Hindu religion. So till the time these fundamental changes don't come in, there is nothing that is going to change. We have seen how in the past Pakistan has always advocated, anti-India rhetorics, has spoken against the Hindu religion. Well, these are basically hollow statements which Shehbaz Sharif has given, and the fact remains they have not only taken so many IMF loans, they have gone to virtually every country they could go to in the last so many decades and take whatever little money is thrown at them. I stand by a statement, whatever money is thrown at them, Because now the state has come, Asabri, that nations do not want to give them anything, but the way they beg, nations out of sheer, sympathy just throw money at them. So the fact remains, these statements have got no merit. They all are baseless. They all are hollow.
Right, sir, absolutely. In fact, still with us on the broadcast is Group Captain UK Devnath. Sir, I'm going to, ask you a question on the same lines. Pakistani Prime Minister Shehbaz Sharif is now trying to portray an image that they're now on a level playing field, talking about trade and economics. Where does that mindset come from? Because from what I remember, just a year ago, they witnessed a complete food crisis. And that's just one of the things that I'm talking about right now.
Yes, Sabri, this is a classic laughable scenario where a beggar is trying to explain to his army officers that he is not a beggar. Pakistan has survived on zakat collected from all over the world for last few decades. Pakistan collects officially, unofficially, and sometimes by arm twisting. Let us not forget that each time there is a shortage of money in Pakistan for any purpose, their Prime Minister, President, and Army Chief and ISI Chief, they run to Abu Dhabi, they run to Saudi, they run to Qatar, they run to European countries begging for money. IMF, World Bank and ADB have given billions and billions of dollars of loan to Pakistan. Many times it was a grant. That means even Pakistan did not have the capacity of returning it. But unfortunately, Asabri, what is happening, since I am linked with banking families also, my relatives are working in IMF. What happens that there is a system wherein World Bank, IMF, ADBs, they send their auditors to Pakistan to find out the last use of that aid given to them. The phenomena is called end use certificate, wherein at various level Pakistani authorities give a certificate that the money borrowed by Pakistan has been spent in a judicious and bona fide manner for number 1, 2, 3, 4, 5 purposes. That means for which it was taken from IMF, for which it was borrowed from World Bank. Now what happens, Pakistan over the year has become an expert. When World Bank or ADB auditors go and check the financial details in Pakistani books, they have become an expert in concocting the record keeping. So they may divert the money for some other purpose, whereas actually it was taken for some other purpose. A classic example is last ADB report, 2023, in which they have said that Pakistan had taken money for ensuring that each child gets a sufficient amount of nourishment in Pakistan. So the money should have been channelized towards their mothers. But where it landed up finally, the money was spent towards family welfare of Pakistan army families. So there is a distinct division. ADB gave the money for buying, say, dry milk powder, but the money was diverted towards welfare of Pakistan army families, saying that they need following basic human requirement. So Pakistan has become an expert in concocting or doctoring their financial records. This trend must be, this is a very, very dangerous trend. We have our representatives also on the board of ADB, World Bank and IMF. Probably Indian rep also should be part of this audit team when they go to Pakistan to check their final expenditure as claimed by end user certificate given by Pakistani authorities. Yes.
Right, so absolutely. With that, I'd like to thank both our guests for joining us on the broadcast, sharing their perspectives. On that note, we slip into a very short break. Thanks for watching.